evening. The two hospitals in Abilene tonight say they had no choice but to cut staff and cut some employees' hours.
They say the governor's executive order putting a hold on elective surgeries is leading to the loss of millions of dollars. KTexas reporter John Rapolo live from Hendrick with the story tonight. John?
Yeah, Abilene Regional and Hendrick admitted today that the coronavirus is indeed affecting staffing issues. All this after we began to ask some very tough questions earlier this week. On Tuesday, KTexas received this message from an ER nurse at Abilene Regional. The nurse wrote us saying, "I just got taken off the schedule from Abilene Regional ER. And from what I'm hearing, this is happening all over." And that's when we started asking questions. Hi, it's John Rapolo from KTexas News. First, we contacted Abilene Regional. And after a series of emails back and forth Tuesday afternoon, we finally got this answer. A very small number of individuals in areas where services have been curtailed or suspended were placed on furlough. We asked what that number was that were furloughed, and we never got an answer. We also learned Abilene Regional has reassigned staff and is encouraging some to take vacation. We also reached out by email to Hendrick Medical Center, asking if they have implemented furloughs. Again, after a series of emails back and forth, asking for clarifications, we finally got this response. We have not furloughed any employees. Hours have been reduced in some areas due to decreased volumes. We are actively cross-training these staff members to prepare for the surge and providing alternate work arrangements for them. And then one day after we started asking these questions, both hospitals spoke publicly for the very first time at Wednesday's city press conference about staffing cutbacks.
But this is taking an economic toll on Hendrick as well. With 50% of the volume decreasing, that is a financial hit. So healthcare is not immune.
The major reason for the furloughs and reduced hours, elective surgeries have been postponed to make room for a surge of COVID-19 patients that may need care. According to the Associated Press, this is happening all across the country in most hospitals. Okay, both hospitals earlier today said they hope to retain those services and those staff members who have been cut and are now working with less hours once this pandemic calms down. We're live at Hendrick. John Rapolo, KTexas News.